Okay, so we're going to now go ahead and get started with our one of the most overwhelming by the look of it chapter, drugs for nutritional disorders, which is basically our vitamins and minerals. So it's a fairly short slideshow, but we're going to go over the big grid that is all our vitamins and our minerals, just to kind of show off what patterns we have discovered in order for us to kind of just understand a little bit and apply it. So typically our indications for vitamin and mineral supplements, I mean, first and foremost, typically it's always a bad diet, either by inadequacy or because of malnourishment or undernutrition. There's they're all pretty identifiable. There's going to be a big slide nearly at the end talking about malnourishment. And there's so many different things: fad diets, poverty, malabsorption issues, so many different things. And I mean, right there, malabsorption, right? Increased need. I mean, typically when, like in, for instance, pregnancy, people that are healing from very major trauma, you typically need more proteins, you need more vitamins. I mean, after all, that's why we have the prenatals for women. You know, they have, I mean, we've seen in our clinicals as well, those, for patients that have had like major trauma, they give them like a nutritional supplement called like Juven or other things, and those are just like a bunch of protein in a drink. So it helps you out with healing. And then deficiency, usually caused by medications. One of the biggest examples we have is our thiazide diuretics. They drop our sodium count, right? Loop diuretics themselves also drop potassium, so that's a big one. I mean, after all, we learned in the other slide that potassium is very important, and losing a lot of it can cause major problems down the line if it's not addressed correctly, right? So, I mean, the indications are pretty straightforward. If we're sick, if there's more need for it by healing or pregnancy, bad diets, or because of some kind of medication is causing the issue. Again, the biggest thing is like perhaps you don't need to memorize all this, but just be able to recognize it when you see it, especially in questions. Again, it's like there's so much information that we have to get down. You kind of have to stop trying to memorize, but just be able to identify and understand, and then be able to interpret that information. So right there again, inadequate diet, we're just either not eating well, or there's not enough food, there's so on and so forth. They're in poverty, they're in a fat diet, so many different things. There's malabsorption syndromes. I mean, after all, like, to make a real life connection, if you think about it, people with lactose intolerance have issues taking up that lactose, you know, and they get like abdominal issues because of it. So there's one right there, and that makes them susceptible to not getting enough calcium or, you know, vitamin D in that way. So you have to find different ways to give vitamins and minerals. And then again, this one is as cut and dry as we know. I mean, it's trauma, pregnancy, illness. You just need more supplies. And then as mentioned again, deficiency. So cause for medications, and we have our examples here with our loop diuretics, mainly for potassium, because that's the biggest one. So that was just a little review, just to give us a little bit more. But again, no need to memorize. Just be able to. If it says, you know, increased need for nutrients, we should be able to know, oh, that means trauma or pregnancy or illness. So we want to go ahead and just keep that in mind. Now, as for our water-soluble vitamins, right, so typically they're going to be all our B and our C vitamins, right? So in this kind of case, we do have this, which is very helpful. The next slide is also a continuation of the B vitamins and vitamin C. However, we have a bigger grid that was uploaded prior to this video that kind of captures a little bit more. But I did my best to keep it as consistent in terms of the like the side effects, the side effects that occur, and what is it for. So we'll go into that a little bit more. And as mentioned, this one is just a continuation of that one. So we'll just keep it going. So biggest thing in terms of the role of the nurse, right? I highlighted the things that are the most, I guess, things to watch out for. Whatever's not highlighted, those are kind of just more, you kind of should do that all the time, you know. So the big thing is recommend multivitamins to avoid overdoses. So the way I'm understanding that is you typically want to cover all your bases, right? And I mean, usually when has there been a time that they only give you an isolated B vitamin? Like they only give you B3 typically. Or they only give you, you know, I don't know, B6 or something like that. Or vitamin A only or something. I mean, it's kind of rare. And then sometimes people kind of get overboard and then they take way too much of it thinking that that's going to help them, when obviously we've learned that that actually could be very detrimental. So it's good to recommend the multivitamin because just think about it, you know, you give it one time a day and we're done. We don't have to, you know, the patient can be reassured, hey, you know, you took it already one time, we're okay, you don't need to take more of it because you run that risk of overdosing. Whether it's multiple multivitamins or multiple of a single vitamin, again, what did we learn? More is not always best. And then less is obviously not as good either. Education or indication, we already, again, that's what we're learning in terms of indication. And then education as a nurse, you're always supposed to do that. Monitor for adverse reactions, we always do that. Monitor for overdose. Again, we always do that. I mean, if anything, adverse reactions is one of those things. Like we mentioned before, I'm going to just keep repeating it over and over. We learned it in our endocrine chapter. We're learning it right now with all our stuff going on, even in the chapter prior with electrolytes. Sometimes treatment for an issue that is too high or too low, as you're giving that treatment, you're going to cause a paradoxical movement where now you're doing the opposite, or the outcome is now the opposite. So if you were hyponatremic for a moment, then like, you know, giving too much fluids with sodium in it now makes you hypernatremic, and you don't want that. So again, it's the same way with adverse reactions. So it's just like another way of saying it. And then caution patients with a history of kidney stones against using vitamin C. Vitamin C kind of makes it more of possible to have kidney stones. So that's a big one, and it's in the chart as well, that in the big chart that we have. That is actually one of the possible side effects with vitamin C. However, that one's more of a high dosage warning than it is a, hey, you know, here's an orange, you're now going to have kidney stones. You know, you have to take a substantial amount of vitamin C in order to get kidney stones, but there is a possibility. And again, like always, patients always think, oh, if I take a bunch of it, I'll be fine. Obviously, again, what are we doing? We are recommending them, you know, either a multivitamin or to go within normal levels to avoid the overdose, or, you know, other adverse effects. And then water-soluble vitamins are not stored in the body, and they must be replenished daily. This is in contrast, and I should have written it down, come to think of it. So water-soluble vitamins, you know, they're not stored in the body typically. We need them every day. And usually in that case, they're water-soluble, right? So they are basically suspended in our blood. And where does our blood typically go to that eventually gets excreted? Into our kidneys, and we make them out of urine. So as easily as they come, they easily go. In contrast, fat-soluble vitamins, so vitamin A, vitamin D, vitamin K, vitamin E, those, which we can use the anagram ADEK, which is A-D-E-K, ADEK. Those are not as easily absorbed, and it's actually recommended that you would take kind of fatty foods in order to, like at the time, it's like a proper use of time management, I guess we can compare it to, right? You want to, if you're going to be breaking down fats already, like you're eating a food, like obviously you don't want to go too overboard and eat too much fat. But like foods with a little bit of fat, you want to take those vitamins, those fat-soluble vitamins are ADEC vitamins, and we want to use those at the same time as you take the fats because your stomach is going to be working on that. So if you take them, that leaves that window open so that your body can absorb those vitamins. And the nice thing about lipid-soluble vitamins is that they stay in the body for longer. They can actually be stored. They could be stored within the liver typically, and they could come out in times that are very, very necessary for them, like extreme starvation. You've been out, like you haven't eaten for anything, and as we've learned, we need our vitamins. We need them to just function in general. So obviously, the nice thing is that our body has like a backup in that case. The only problem is that our water-soluble vitamins, they don't. That's the reason why sailors out in the ocean, because there's no citrus fruits, and where do we find vitamin C typically? We find them in the tropical environments, but you need to be on land. You can't really be in the ocean. So without any vitamin C, a water-soluble vitamin, you run out of it pretty quickly, in just maybe a matter of like a day or 3, or depending how bad is it, or like a couple days, maybe 5, and then from there you're kind of screwed. So you need to have like constant daily supplements of your vitamins in comparison, to your water-soluble vitamins. Compared to your lipid-soluble vitamins, that you have backups. Obviously, you don't want to those shouldn't be the first thing to go to, but the nice thing is that the body at least has a backup for those. So, at least keep that in mind. One of the biggest things is that, as well, overdose can be kind of a little bit more susceptible for lipid vitamins. Because again, your body stores them, so you're a little bit more inclined to possibly go into overdose of those ADEC vitamins than it is water-soluble vitamins, because water-soluble vitamins easily get excreted out. So keep that in mind. And then pause real quick. Alright, so there is one thing that needs to be noted, and there is only one exception, really, to the rules about water-soluble vitamins not being stored in the body. Only B12 can be stored in the liver. So that one can actually stick around for a little bit. But as for all the other B vitamins and the C vitamins, even if you take them in excess, they're going to get urinated out. But the only exception is our B12 vitamin. So do keep that in mind. Beyond that, as mentioned, there's not much else in terms of the lipid-soluble vitamins, but do keep in mind that for lipid-soluble vitamins, you can run a possibility of toxicity because it's stored in you. So because it gets stored, your levels can go up, and then toxicity can occur. So keep that in mind. But that's essentially it in terms of things that need to be known about vitamins, at least general things that you can educate your patient on. Now we're going into minerals, right? So there's 2 different types of minerals. Oh, and one thing to also bring up. Vitamins are organic. Minerals are inorganic. So kind of show what's the difference between both of them. There are 2 different types of minerals, right? There's our macro minerals and there's our micro minerals. Typically, macro minerals have to be taken at around, if I recall right, 100 milligrams per day. Micro minerals cannot be taken in excess of over 20 milligrams. So you want to, it's in the name. Micro, have as little as possible. Macro, big. So you want to have around 100 milligrams per day. Big thing to note, usually our micro minerals are things that kind of, they're more in line to metals. So iron is right there. Iodine right there. I mean, after all, what did we learn about iodine too when it comes to our thyroid? You know, we don't have an excess amount because you can either pause the thyroid from working or you make too much TH, too much thyroid hormone, you know, so that's a bad thing. Fluoride and zinc. So those are all kind of metals, you know, iron, iodine kind of metals, zinc, metal. So do we want a lot of metals? You know, probably not. That's not a good thing. But that doesn't mean we don't need them. We just don't need them that much. But then after that, what are our macro minerals, right? Calcium, chlorine, magnesium, phosphorus, potassium, sodium, sulfur. Didn't we hear about those in our electrolytes slides? Yes, we did. And we learned that these are so important to our body, like really important. So it makes sense that you would want to have a good amount. You want to have an abundant amount because the minute calcium starts failing, you run the risk of losing also magnesium because magnesium usually goes hand in hand with calcium. And then it also goes hand in hand with potassium. So it's like they're all interconnected. And the minute one fails, I mean, it's like what we learned in the body and physio. If one organ fails, what happens eventually? Another one is going to fail too. And it's just a big domino effect. So big thing to know about that. I mean, we already disclosed this on the freaking vitamins one too. Excess minerals can be toxic. I mean, excess vitamins, again, excess of anything is bad. So we don't want to go overboard and that type of stuff. So beyond that, we can now just go ahead and move on to the next slide because there's not really much else to.
Iron deficiency is the most common in the world.
Okay. Yeah, okay. That's a big one, at least in terms of knowledge. Iron is usually the first or the biggest deficiency, which, I mean, what we've heard a lot. Anemia. What do they usually give? Iron or ferrous, sulfate or glycinate. So typically that. So keep that in mind. I mean, it makes sense. I mean, usually you do hear more about iron deficiencies than you really do about anything else. So yeah, it's like something more to know. But that's essentially it, so we go ahead and move on. All right. So, magnesium, right? This is more of a review than it is anything else because we kind of went over this already in our electrolytes slides, right? So, the main functions of magnesium is typically for proper conductivity in our muscles, right? So neurons that go straight into the muscles. And what was the big thing that we learned? It's more about relaxation of muscles. What did we learn about hypermagnesemia? Usually it brings your body way too relaxed. So whenever you think of magnesium, kind of think about or make like some kind of silly word or connection if you're having a difficult time to connect magnesium with relaxation, because that's what's going to happen when you have way too much. And then what did we learn when our magnesium is way too low? Our body is way too excited. We start having exaggerated reflexes. You're anxious, you're restless, you're super, you're contracted and everything, and you have your Trousseau sign and your Shavastic sign and so on and so forth. So again, that's the nice thing. This is more of a review. Beyond that, something that it could do as well is that it helps out with the metabolism of carbohydrates and proteins as well. So just big thing with that too. But this has always been the biggest one. The biggest one. The proper neuromuscular function, that's the hugest thing. Obviously, breakdown of carbs and proteins as well, important, but this one could be deadly. And what have we learned typically? What's deadlier is kind of the first priority than it is the other things. But do keep that in mind. It does basically two things. As for its primary use, right? I mean, think about it. It's for severe hypomagnesemia. I mean, obviously you're going to give it for that. But there is also something that must be known. Extremely severe deficiencies, right, of magnesium, it appears that it's actually restricted. And the way I'm imagining is like, this is hypomagnesemia, right? So this is just a low level of magnesium in the blood, the serum, the plasma. This is just simple low level. But if we have a deficiency, that means there is it's like hypomagnesemia but with extra steps. And again, what did we talk about in the electrolyte slide? Do you want to give someone who has been starving and hasn't eaten in like a week, do you want to give them food and tell them to go crazy and like eat as much as possible? Probably not, because that is going to cause a paradoxical event that can be detrimental to them. So I would imagine, I mean, it says restricted. It doesn't say you don't give it. It just means you probably have to taper them to get them to that level, because you don't want to overload them. Because what did we learn again? What does magnesium do? Relaxation of the muscles. So if someone has been completely deprived of magnesium in a deficiency, then it is something as simple as having a low level of magnesium, then that means that you're giving them a higher, in comparison, a higher dose, because they haven't gotten anything. That person hasn't had any magnesium. So the first moment they give you magnesium, your body's going to freak out and be like, oh my goodness, thank goodness, this is what I've been wanting. But now we have way too much relaxation, which we learned with high levels of magnesium, which our body will take it as that way. It'll cause our body to basically go into cardiovascular collapse. We'll stop breathing, we'll become cyanotic, our heart will stop, and we can die. So that's the reason why there's two differences. Like the severe hypomagnesemia, obvious, yes, you're going to want to give magnesium to somebody that's having low levels. But if they are having a straight up deficiency, that one you want to kind of tread a little carefully, because you could cause damage while providing care. The other one too, I mean, it goes hand in hand, relaxation of the muscles. It prevents seizures for women during situations where they have eclampsia, right? After all, a seizure is like the most, in its purest form is central nervous system stimulation, where we're having like way too much movement, we're convulsing and everything. So it has been shown that magnesium, as we have already read, and I'm just going to reiterate it over and over, magnesium has that capability of relaxing you. So what is something you want to give to someone whose entire central nervous system is too excited? You want to relax them. So this is the reason why it's given for seizures in eclampsia. It could be given as a prophylactic, and it could be given as direct treatment. Again, obviously, dosages matter extremely heavily because you don't want to go overboard, but there's that. And last but not least, magnesium can be used as a cathartic to completely evacuate the colon. And I mean, after all, it's like, the way I remember it, or I could use that to remember, is like, someone is holding it, they're holding it, they don't want to go to the restroom because it's not their home or something, I don't know. And they're holding it and holding it, and they're just collecting it in their bowels. But, they need something to eventually get, they need to be relaxed. Maybe they're too tense and they can't really go to the restroom. So they need magnesium to relax their bowels and let them evacuate everything. Not the best connection, but at least it goes back to the theme of relaxation. That's the big one right there. Relaxation is the big one. So keep that in mind. Right? Yeah. Again, adverse effects. This is just a repeat of what we were talking about for hypermagnesemia. I highlighted the signs and symptoms that we can make a connection to high levels of sodium, like the flushing in the skin, the confusion, the intense thirst, and then I highlighted in blue things that signify central nervous system depression, such as sedation, muscle weakness. Extreme levels can cause that neuromuscular blockade, which means complete like becoming completely limp. And then that respiratory paralysis, heart block, circulatory collapse, and loss of deep tendon reflexes. And I mean the biggest one here, the deadliest one, is that respiratory paralysis and heart block. I mean, it's going to go into heart failure, like complete heart failure, eventually. Because can we really live with a heart block? No, because eventually it's going to cause your body to just shut down. So it's like we just talked about earlier in the slides. It causes a cardiovascular collapse. So this is just more of a review than it is anything else. And if you just think about what it is and remember that magnesium is relaxation, so high levels will cause way too much relaxation, and low levels will cause too much stimulation. So we'll just...
Which it has like that, there's a version of magnesium salicylate, that can be used as an analgesic.
Okay,
so that might pop
and
up.
you know what, that makes sense,
That makes
because it also, I mean, you could use the name too, right? A salicylate, right?
You can use
What is aspirin? It's acetylsalicylic acid. So it's that's a kind of a tough word, but a silicate, which is a type of analgesic. So big thing. I mean, after all, when we're in pain, are we tense? Are we having, are we uncomfortable? What would we need? We need something to relax us. Now we're coming up with zinc. So zinc is not typically used as a supplement all the time. Most of the time it kind of needs more of an indication for it. I mean, the biggest one is it's a helpful element of metabolism. But then again, if you think about it, every single vitamin and mineral, I mean, this is kind of like being too general, but typically they all help out in some form of metabolism. Whether it's metabolism of other macromolecules or whatever the heck, or of energy, or oxidation processes, or creation of DNA, or, they're all going to typically do that. So, I mean, the biggest thing is just kind of be able to know that, like, these things are essential. That's the reason why we need them. But not only that, they're typically helpful for things like wound healing, mineralization of bone, and one very big one is the production of insulin and glucose, which is a little trippy. Never really expected that zinc had such an impact on that. And then last but not least is also taste. Typically, what are we going to really have as a sign and symptom? I mean, we just talked about how it gives you normal taste. So if you have an alteration to your taste, right? So you have reduced taste perception, or, I mean, there you go. There's one. Maybe give zinc. Another thing too is you have bad glucose control. Probably want to give zinc as well. Then I mean, there's your dermatitis, your hair loss. I mean, those are a little bit weirder. A little bit on the weirder side. I mean, maybe you kind of think of zinc, it's kind of a funny sounding name. This is kind of a funny type of, like, whoa, how can there be a connection to these two? Zinc, how could zinc really do that? Or not having zinc?
If you look at the sterility, it probably has something, right, because it's male sterility.
Oh.
It probably has something to do with testosterone, right? Which
so
would affect your skin and your hair loss.
You know what? Yeah, that's perfect. So initially think sterility, and then if you think sterility, think skin issues, because usually that does happen, and then hair loss. So you'll have loss of hair, which is, I mean, again, loss of testosterone will cause loss of hair because you're not producing it.
You're losing, right? Because the book is male fertility. This thing just says sterility.
Oh, that's interesting. Yeah, okay. Well, beyond that, it's also used for wound healing. So if you see poor wound healing, probably give zinc. Professor Huang did say that it could be given orally or it could be given topically. In fact, there's a lot of different ointments that we have seen that is used topically to provide a little bit of wound care. I mean, we've seen that too in our clinicals too, so.
That's that barrier cream she was talking about, right?
Yeah, so it's very, I mean, zinc, we want to think about insulin, because that's a big one. Taste, we want to think about wound healing, and as well just, I guess, mineralization of bone. That one's a little tougher to think, but perhaps with repetition, you'll just be able to recognize it the same way. But I guess zinc, in a sense, works hand in hand with parathyroid hormone, because after all, parathyroid hormone is mineralizing bone, so maybe you can make a PZ kind of connection perhaps with parathyroid. But beyond that, it's usually found in a balanced diet, like all of our vitamins really. Now, do patients typically have a well-balanced diet? Not really. So that's why usually it's, there's an indicator which would fall under any of these categories, and that would be there. But typically, I mean, the nice thing about zinc is that it's kind of a universal thing. It could be found in your meats, like meat, organ meats, liver. Liver's kind of the only one I'm really thinking about right now, but I mean, that's a big one. Usually when they say organ meats, they typically lean to the liver more than anything else. Oysters, which is just a type of seafood, which is meat of the sea. Poultry, which is, it's just chicken, so there's that. There's fish, which is, again, meat of the sea. And then whole grains and cereals and bread. So it's kind of universal. I mean, one thing that we'll see right now when we do our big grid is that we're going to see a lot of vitamins, especially the B vitamins. They come from whole grain breads and cereals, fortified cereals. So do keep that in mind. And actually, now that we're done with zinc, we could go ahead and go to the big grid. So I apologize, the grid is huge, so it's not the most clearest picture, but if you have the slides and you're following along, you could zoom in at the same time. We're just going to go bit by bit, and then we're going to conclude with like the connections we make. But I'll zoom up a little bit, but I mean, we do need the entire slide to be able to see. So just if you have the slides available, follow along. So the nice thing, again, what was it that we did? A DEK, A-D-E-K, which is our lipid-soluble vitamins, meaning these can run the risk of having toxicity in a sense, because we store them in our body, right? So, big thing with vitamin A, right? Vitamin A, the biggest thing we can imagine is, I guess you could say, because its precursor is called carotene, right? Carotene, carrot. What is something that we've always thought about carrots being helpful with? Vision. So that's a big one already. Because a deficiency in vitamin A is usually night blindness or just bad vision in general. From there, also, the active form of vitamin A, and we could think about our eye, is called retinol. What is something that's in our eye that sounds very similar to retinol? Or retina. So, there we go. We're now making connections, right? So, the thing that's also helpful to know, so we already got one of the things down about what vitamin A does. Vitamin A will also do 3 other things. And funny enough, we're going to make a big connection because a lot of these other vitamins also do this as well, which is wound healing. A lot of these have a lot to do with wound healing. So that one's kind of more of a blanket statement. I mean, obviously vitamin D won't really do that, nor will vitamin K. Vitamin K kind of does wound healing in its own different way, but we'll get into that in a little bit. But typically it's like so general of a statement of wound healing, you're going to see that that's a very reoccurring thing. So it's not something wild. Other than that, we have biosynthesis of steroids, right? And I mean, it's a lipid-soluble vitamin. What do we need to make steroids? It's in the name, cholesterols, steroids, that's where they come from. So I mean, and the nice thing is that vitamin A is the only one that really does that. I could think of vitamin A, vitamin Arnold Schwarzenegger, which, you know, obviously he used steroids. So, I mean, there you go, biosynthesis of steroids. Think vitamin A, vitamin Arnold, steroids and stuff. Other than that, I mean, it's growth of bones and epithelial membranes, which, I don't know, that one you just kind of have to memorize. Like that one I'm having a little bit more of a hard time just remembering, freaking, you know, bones and skin, or like, you know, your membrane and all that. So that one's a little tough.
You can still use your Arnold reference, right?
Yeah. Oh, wait, yeah.
HGH, right? You're lifting, your bones are going to get stronger, but HGH, right? You're growing. Right?
Yeah. Okay. Yeah. No. Then in that case, it's perfect. I mean, after all, too, you could just piggyback off of the steroids thing.
Yeah.
So big things to remember. First, just remember your eyesight. Then remember that it helps out with wound healing, because I mean, all of them really do that. And then use of steroids, creation of steroids, that causes growth one way or another. By either your bones, by, you know, growing, because Arnold used steroids, you know, to become bigger. And I mean, how do you get bigger? You grow your body, your membranes and everything. Heck, even the steroids goes into wound healing. It just accelerates it. So that's a perfect connection.
Pause. Just continue.
Okay. All right. So we have additional things. So big things. We have overuse of vitamin A can cause CNS toxicity, and usually those are indicative, like in things like headaches, drowsiness, delirium. So biggest thing is just if you start seeing signs and symptoms of like alterations within it, like mainly in the head, changes in behavior, like the irritability, drowsiness, and delirium, point to that one. Remember vitamin A, and honestly this is the only one of the very few that actually has that effect, so that's unique to vitamin A. And I guess you could kind of say that too, you know, I mean, if there's biosynthesis of steroids, I mean there's the whole aspect of like kind of a change in how you think of overuse of steroids, you know, so if you have that going on, then you'll have a different alteration with that. As for chronic use, I mean, again, dry, scaly skin, alopecia, fatigue, anorexia, we can make the connection back to the steroids. I mean, the skin, that gets dried out. Anorexia, I mean, people who are typically on that don't really want to eat because they want to gain more muscle than they are like eating properly, so anorexia is there. Leukopenia, that one's a little bit more limited to this one. So again, it's unique to vitamin A, so you kind of remember that. And then toxicity to the liver. That's another thing that occurs. There are multiple ways of looking at it for signs of deficiency. There's a lot of them. So one of the biggest ones is acetoturia, which is oily bowel movements. I mean, again, if your bowel movement is oily, you're losing oils, you're losing fats, you're losing lipids. So a loss in this will typically cause issues, but the biggest one is that it's usually more direct with vitamin A. So that's a one. I mean, liver issues as well, pancreatic issues. So think, you see liver and pancreatic, immediately you could kind of start pointing to vitamin A. You could also kind of point out to other ones too, but at least right now just think of vitamin A. And then as well, blindness. I mean, again, deficiency. It's going to cause issues with your vision. So if that happens, then you're going to want to go ahead and revert back to thinking, hey, they need carotene, you know, they need their retinol because their vision is bad. And then signs and symptoms of the deficiency, pretty quiet in terms of signs and symptoms. It's really the acne, dry and scaly skin. I mean, those are, but you know, we're noticing that they're both side effects and signs of deficiency. So, I mean, you can make that, it's like, hey, it's a double thing. It's like a double trouble thing. And as for the other one, that's more straightforward, night blindness. Your foods, Easiest one to remember is your yellow, dark green leafy vegetables, which, what did we talk about? Carotene, carrot. Usually when I picture a carrot, I picture, the carrot itself, but the big leaf on the stem. And then another thing too, it could be from milk, it could be from eggs, or our organ meats like liver. And then big thing, vitamin A is a pregnancy category A medication. However, once you pass your recommended daily allowance, it's category X. You can't have it anymore.
We're done with A?
Yeah, we're done with A. Alright, so now we're moving on to vitamin D, right? Vitamin D is typically associated with our calcium, right? Brand names Rocatrol, Calcigix, vitamin A, Aquasol A, which is nice, Aquasol A. Good thing is that a good handful of these vitamin brands usually have something that kind of, gives you a little hint. In terms of vitamin D, Rocatrol, right? So I think vitamin D, too much calcium, it could happen. What happens when you have too much calcium? Kidney stones. In Spanish, what is the Spanish word for stone? Roca, Rocatrol. And then Calcigix, it's in the name, it's just calcium, but don't think calcium directly, think vitamin D. So that one's a little tricky, but once you get it down, you'll be able to recognize it, right? So, big thing that this is more just review, because we've learned it in the past exams. Vitamin D, right? It typically helps us out with increasing absorption in the GI tract for calcium. It also helps us minimize the possibility of taking calcium from the bones, so it decreases resorption from the bones. And then it elevates calcium levels. Again, it's just, that's mainly what it's for. Signs and symptoms of, side effects of having too much vitamin D would be basically what we learned about hypercalcemia. And that's more a review of already what we went through the electrolytes. So we're okay on that one. We could just go ahead and move on because we already covered that. Deficiency, typically it could be bad sun exposure because we do need the sun for vitamin D. It could be hypoparathyroidism, which if we just look at it already, we're going to know we're not bringing calcium into the blood serum. So if we're not doing that because our parathyroid is down, what is another way? Well, vitamin D basically does the same thing. The only difference is that it doesn't do bone resorption, which is what you want to do. You don't want to pull too much from the bones. Impaired kidney function as well. Rickets is basically what happens when there's a complete vitamin D deficiency in a child. Osteoporosis, again, low levels of calcium, so you have to give vitamin D. Hypocalcemia, that is as direct as you can get when it comes to vitamin D. And then our signs and symptoms of the deficiency is, there it is, hypocalcemia again. And what did we went through for electrolytes? It's mainly all our conductivity issues, our twitching, spasms, seizures, and tremors, and excited reflexes. Foods, right? Fortified milk, margarine, dairy products. It's as straightforward as it gets. Now, in terms of vitamin E, right? So, vitamin E is more of an antioxidant. So, when you think of vitamin E, brand name Aquasol E, think antioxidant. Vitamin E, antioxidant activity. So, kind of just something to kind of help out in that way to get it down, right? And what antioxidants do basically is help prevent free radicals from damaging cellular structures. And that is a blanket term because that can be applied to anywhere in the body, really. But in that way, it could also decrease the chance of platelets from clumping. That's what we were having an issue in terms of our grids. So keep that in mind as well. And we could kind of rationalize it in a way that, vitamin E is an antioxidant, right? Vitamin E, antioxidant. So it could see the platelets as an issue, like a free radical, because a platelet could become all grown and like get big and clump up with other platelets, and then it can go and get blocked in the blood vessels. And then what do we have now? We could have a stroke. We could have some kind of ischemia occur, and then that could lead to death. So vitamin E will see platelets as a issue, so it will decrease clumping. It's not like it's a straight blood thinner or an antiplatelet. It'll just lower the chance just by a little bit. They're not going to do magic. Side effects typically are going to be your nausea, your fatigue, headache, very, very, very high dosages, right? I mean, nausea, vomiting, fatigue, headache, those are such blanket statements that honestly, what med doesn't really cause this? I mean, there's a lot, I'm sure there is some that don't, but typically you're going to have issues like that. So kind of think generic with E, like generic symptoms. But the biggest one, and what I use for vitamin E, is that very high dosages will cause blurry vision. So what I think is like I make an E with my hand and I point it to the sky, and that's representing that there's high dosages pointing to the sky, and I put it in front of me. And now my vision's kind of blurry because I can't really see as well, because now I have, 3 fingers right in front of my face. So again, vitamin E, an antioxidant, now we make an E with my hand and point it to the sky and put it in front of me. So high dosages, now that means blurry vision. So that's one way to remember that. Besides that, I mean, deficiencies, usually this is a blanket statement. Severe malabsorption, that kind of falls under every single vitamin. But the most unique one is prematurity. So when it comes to E, just think a lot of these like E-sounding things, right? Vitamin E, antioxidant. I mean, I know there's no E in there, but it sounds like there is. We have the high dosages up in the sky, blurry vision, and then we have prematurity. Usually the signs and symptoms of deficiency are going to be like problems when you have too many free radicals floating in the system. You're going to be having fatigue, which funny enough is a side effect already as it is. But you're going to have weakness, which is another way of saying fatigue. Ataxia. When you're feeling very weak, are you really feeling like you're going to move? Not really. So again, ataxia. Numbness and tingling of extremities. I mean, that one again kind of goes hand in hand because there's issues going on in the conductivity issues, I guess, and like just general weakness. So this is why I put in red right here, because it follows a theme of general weakness typically. The vitamin A one had skin and vision issues. Vitamin D had low calcium levels, while vitamin E is more generalized weakness for deficiencies. The big thing is that this one is typically found more in your nuts, your whole grains, your eggs, your plant seed oils, and organ meats. So it's kind of similar. It's in a sense like just kind of like piggybacked a little bit off of, it's its own thing. It just only really piggybacks because of the eggs and the organ meats from vitamin A. So at least think about it, like organ meats are typically found, for all these vitamins, not except vitamin D. So organ meats, that already covers this base right here. And then your nuts, your whole grains, your plant seed oils, those are kind of found in other areas too. So again, like typically, we're just trying to form patterns. We're trying to form connections. So just kind of start kind of thinking, hey, I'm seeing eggs. Egg, so that already kind of shows it. So typically eggs will be found, all these lipid soluble vitamins will be found in eggs except vitamin D. Organ meat. There it is. I mean, again, organ meats except vitamin D. So they'll all be found in organ meats except vitamin D. And then as for lean vegetables. leafy green vegetables. So A and E, A and D, leafy green vegetables. You know, so start forming patterns. You could look at this and start like really catching on, like, oh my goodness, you know, we're finding multiple of these. So that's why like problems, where you're addressing them, you're actually supplementing other things too, because you're eating as well.
I'm just seeing the healthy fats, right?
Mhm.
Like
Yeah.
that's what I'm seeing. I'm seeing
Yeah, your healthy fats, your plant seed oils, whole grain, nuts. Nuts can contain oils as well. And then that finally leaves us with vitamin K. Vitamin K is a big one because that one is referring more to clotting. Vitamin K clotting. I know clotting is with the C, but vitamin K clotting. Think clotting. And it's maintaining hemostasis, which is a really just blanket word to say the blood is working like it's supposed to. Which, is it supposed to clot when it needs to? Yes, it does. So there is just two individual things that must be known about vitamin K. There's two different subtypes. There's K1, which is usually comes from food, and then there's K2, which comes from the bacteria in our gut. There is just one big warning. They don't really have any crazy side effects in terms of regular stuff, but it does carry a black box warning. We should recognize that anytime we see black box warning, that's really bad. And apparently when given through muscle or IV, it can cause anaphylaxis, shock, or cardiac arrest. As for the anaphylaxis, that kind of occurs with almost every meal. That's a warning, that's a universal warning. But as for the cardiac arrest and shock, that has been seen with vitamin K, so careful with that.
That'll probably come up.
You could kind of think like vitamin K overclotted, and now it was too much in the blood, and it got stuck somewhere in the heart, and now that's causing an infarction, and they now have a heart attack, and then that heart attack didn't get taken care of, and now it became a cardiac arrest. So kind of think about it that way, because vitamin K, vitamin clotting, over-clotted, and now the heart, you know, they're went into shock because they're, you know, cardiac arrest. Usual indications or deficiencies is either the destruction of intestinal flora, so that means the use of antibiotics, especially our broad spectrum antibiotics that kind of just clean out the entire intestinal flora. You typically want to give it because now we don't have any K2, right? So you want to give vitamin K, you want to have vitamin K strong foods, and we'll get into that right now. Clotting issues is going to be a big one. I mean, if you're having clotting issues, give vitamin K. And then it's also given to newborns because it promotes clotting for them, because typically newborns don't clot as well, so they need vitamin K. So there's your couple indications: destruction of intestinal flora, clotting issues, which, I mean, it's like right there, so that one's kind of more obvious, and then giving it to newborns because they can't clot well. As for signs and symptoms of deficiency, I mean, delayed hemostasis, which is basically another way of saying delayed clotting, easy bruising, and bleeding. So this one is so direct, it's super direct. Vitamin K, vitamin clotting. If you don't have vitamin K, vitamin clotting, you don't clot at all, and you'll easily bruise, and you'll bleed, and you'll have delayed hemostasis or clotting. As for our foods, green leafy vegetables. In fact, the biggest one is cauliflower. Now, when I think of, like, if you guys have seen those videos of people, like, of science, like sciencey videos where, you know, it's like you see the blood moving in the blood vessels, and then you see, like, how clotting occurs, and it looks kind of like a web, and it's, like, constantly, like, webbing up. The cauliflower kind of looks like that in a way, kind of, you know, like it sort of does. It doesn't look exactly, but it kind of does. So cauliflower is a big one. Healthy fats, as we mentioned before, with egg yolk and cheese, and then our organ meats, like we just mentioned before. So there it is, right there. And that's all our lipid-soluble vitamins, our deck. Let me get a pause. Okay, so as for a little disclaimer, for vitamin E, right, or vitamin antioxidant, you do need to watch out with people who are having issues with their blood, like anemia. And I mean, it makes sense because again, I mean, if it's messing with your platelets, probably don't want to mess with your blood too. So watch out with vitamin E. And then also for pregnant women or lactating women. So that one, I just kind of imagine it because I don't know. As messed up as it sounds, what do some people call the kid inside them? They call it a parasite. Maybe they, vitamin E sees the parasite as a free radical. So, I mean, it's a messed up way to remember it, but I mean, after all, what's one way we could use to remember it? We come up with either messed up stuff or funny stuff or other things, just something that's going to kick in your mind.
Dark humor.
Yeah. Beyond that, now, one thing to know for vitamin E and vitamin K, you need to watch out with use of warfarin, because those typically will kind of not work with each other and they'll cause high levels. Increasing what?
The effect, I'm reading.
Yeah. Oh, yeah. No, but warfarin is a blood thinner. How does it increase the effect? Okay.
Go for it.
Yeah, so vitamin E will typically cause warfarin levels to go up. Basically warfarin toxicity, which makes you more susceptible to bleeding, which already kind of does because like the platelets don't clump as much. And then in terms of warfarin working with vitamin K, they kind of bash heads because warfarin is a blood thinner and vitamin K is a clotter. So now they're like not going to work as effectively, so warfarin might not work as well. And then in terms of all of these vitamins, they're all lipid soluble, right? I mean, this is why we use yellow. Drugs that are anti-cholesterol, like our statins and anti-lipids, you need to watch out because that could cause an issue with absorption. So that's pretty much it.
Look on the screen. Oh. All right, there we go. So a little bit of a discrepancy here. We got removed from our study room because our time was up. So we're just gonna try to work around this. The nice thing is that I can highlight, and you guys should be able to actually see this a lot clearer now too. So just try to follow my cursor and see wherever I highlight, and we'll just be making connections for the water soluble vitamins. So we have our, as mentioned, we already covered our ADEC, which is our lipid soluble. We now have our vitamin C and all our B vitamins, which are water soluble, which is why we use blue. So first and foremost, we'll just do vitamin C and then B. All the B vitamins kind of coincide a little bit. They work with each other, but vitamin C, so it has a couple uses, right? The quickest one is that whole stopping scurvy. From there, we also have our additional collagen synthesis. And this one, I mean, for me, vitamin C, collagen, vitamin C. There's not really any other uh, vitamin besides, I mean, vitamin A that would possibly like follow under that. Um, so that's one thing that you can use, vitamin C, collagen. It's always been known that vitamin C is an antioxidant. One way that you can make a connection is how people typically always use. Sorry about that. Um, people always use vitamin C as a way to prevent any like flus or colds. So you could kind of make that connection together there too. Sorry, I'm just gonna find my spot again. Um, but it's not proven, yes. But you could look at it as that way as an antioxidant, just because of the fact that it has done that before. Or like people, it has a track record of being used for that. So you could see as vitamin C, antioxidant because it's removing the flu or cold, even though again it's not really proven. From there, it's also been used for wound healing and bone fracture healing as well. So, I mean, typically people have always kind of stuck around with that in terms of knowing it. Like that's kind of a general thing known. Another thing too is that the most commonly over-the-counter purchased vitamin is vitamin C. So kind of big fact there. But yeah, so we have our antioxidant getting rid of the cold, even though, again, it's not really proven, but it helps. Our vitamin C, vitamin collagen synthesis, so think about that. And then scurvy prevention as well. And as mentioned before, wound and bone healing. So another big thing too that typically happens, in fact, this is actually pretty recent with one of my family members, is that they have a little bit of low iron, right? So they have a little bit of anemia, right? Vitamin C is very big with helping out with iron absorption, which is again, it's very unique to vitamin C. So you can kind of start making the connections if you are to just do a little bit of repeating, just looking at the grid, looking at all this, kind of noting what makes everything unique. And the nice thing about vitamin C, what makes it unique is the iron absorption, the scurvy prevention, and that collagen synthesis. The antioxidant kind of comes in, as mentioned. I mean, we have various other vitamins that do antioxidant properties. So, but just remember that vitamin C is one of them. As for that, I mean, vitamin C is a little acidic, right? I mean, whenever we think of vitamin C, we think of oranges, we think of citrus fruits, and those are typically a little acidic. So what happens if you're going to be, taking too much vitamin C? You might have an upset stomach just because of the fact that you're putting acid into where acid is already at in the stomach. So it could cause a bit of an upset. Now, this is where this is a little bit more important, are high dosages, right? So typically, it could cause deep vein thrombosis, right? Now, the biggest way I used to remember it, especially if given by IV, is that, right, so we're thinking thrombosis. So that could mean like we're having a blood clot, right? I mean, it not exactly is 100% with it, but look, collagen synthesis, right? So we have too much vitamin C. We're creating too much, clotting. I mean, again, it's not directly 100% that, but I mean, collagen is a property of clotting, if I recall right. So you have way too much vitamin C, now you could cause a DVT via IV, especially since IV has like one of the more potent um, points of giving medications. So this is a very, like it's just something to watch out for. So collagen synthesis will kind of hint to the DVT. Um, Beyond that, the crystalluria, right? So that means crystals in our urine, if I recall right. That one's kind of very unique to vitamin C, so watch out for that. As for the kidney stones, remember all the way up here in our slides, it mentioned prior, it said watching out with here it is. Caution patients with a history of kidney stones against vitamin C because it could facilitate making more of it, and the last thing you want to do is make things worse. So, um, typically smokers, right? Smokers actually need higher dosages because of so much damage is going on to their lungs. So that's why you want to go ahead and give this antioxidant, which will get rid of the free radicals that we were talking about earlier in the lungs to help them out with that. Beyond that, alcoholism, which we're going to discover with a lot of the water soluble vitamins, is that they help out with alcoholism. So kind of keep that in mind. That's a very important thing to know. Most of the time, we have a lot of alcoholics that we would probably give a lot of these vitamins, except B12. B12 doesn't seem to really help out in alcoholism. But look, here it is: alcoholism B9, alcoholism B6, alcoholism B3, B2, right there. Alcoholism B1. So, and then alcoholism vitamin C. So it's a reoccurring trend going on for all of them except for B12. As for the signs and symptoms of deficiency, fatigue, again, that one's a very universal symptom. It's kind of seen everywhere. But the big ones is bleeding gums. That's something that's just stuck out with me. Again, you hear about stories with pirates and all that stuff, and I mean that's one way to kind of think about it. Pirates, they're not exactly the most, they're pretty shabby looking is what I'm trying to say. So, the bleeding gums would probably fall under that line. And then another thing too, the poor wound healing. Foods that we would typically find, citrus fruits or kiwis or strawberries or oranges or lemons, limes, so on and so forth. Vegetables as well. You got your bell peppers, you have kale, you have spinach. So kind of leafy vegetables on this end, and then our bell peppers. So, it's kind of everywhere around that. But typically you're going to find them, I mean, these are a given. The citrus fruits, the fruits that are a little bit more, like they taste a little more acidic, you're gonna find it there. Um, Now we could go to the big monster that is the B vitamins, right? So we have B1, right? Off bat, I want to make a connection between B1 and B6, just to kind of start making just to help make a flow of things. B1 is typically going to be used in terms of metabolism, the same way how B6 will also be metabolism. However, they both have two different functions. B1 will do it for energy metabolism. So, like I would imagine it means like converting our glucose into, ATP. And then B6 will be metabolism of amino acids. So we'll go into that in a little bit. But again, B1 energy metabolism, B6 metabolism of amino acids. As for B2 and B3, I like to picture they have a lot to do with oxidation and removing oxidation. You see, oxidation reduction for B2 and oxidation metabolism for B3. So those are kind of the themes we're looking at. And then in terms of B1, um, it is also helpful for nerve function. And let's kind of think about that a little bit, right? So we have B1 is thiamine, right? And if you guys have ever taken a nutrition course, people who like historically have had a deficiency of B1 thiamine will usually have beriberi, and that's a big thing that happens in areas that, if I recall right, it is where like rice is the dominant food, and because of that, rice lacks vitamin B1. I mean, it's not really found there. So, rice isn't a whole grain, and it's not a bean, and it's not a peanut. So, beriberi typically has the symptoms of having paresthesias. So you start having, pins and needles. You feel different sensations throughout your body. And then there's also neuroglia, pain in the nerves, and loss of feeling of reflexes. So a big theme about this entire B1, right, deficiencies. You can look at the alcoholism, the liver disease, which is, kind of falling under alcoholism. Pregnancy, you would want to give, just in general, because it's important, because look, it's nerve function. It's the same way how we'll get into it in a little bit, but B9 is very important for the DNA and RNA synthesis, especially for preventing neural tube defects. But that's kind of jumping case. So again, you can kind of have all these different things going on, but the most important thing is remembering that there's beriberi, and these are going to be our typical signs and symptoms from these types of deficiencies. So B1, if you can make a connection about it having a lot to do with nerves. The same way how we can remember about our energy metabolism by 1 and 6, but remember that B1, it's like the number one most important thing is that nerve function. As for red blood cell production and function, typically all the B vitamins will kind of have some kind of effect on it. I mean, look, B6 is heme production. B9 is hematopoiesis, which is another, it's just proper production of blood cells. You could probably make an argument, perhaps, that B12 also falls into that because it's growth and cell and division of cells. But at least be aware that the B vitamins have a lot to do with blood cell production and function. But other than that, look. So typically they could be given for the alcoholics, as we mentioned before. But the very unique thing about B1 is that it's given for substance abuse, and it could possibly help with patients with HIV as well. Liver disease, again, that one is very big with B, like it being already alcoholism and liver problems. Again, just goes hand in hand. Substance abuse would also kind of not help you out in case of your liver, but these are the big trends. Alcoholism is its own thing, and then liver disease is its own thing too. But that connection that we were making with B1 and B6, look, check it out. Cirrhosis. That's liver, that's one of the liver diseases. So just to kind of review a little bit, right? B1, right? It's going to have a lot to do with our liver issues right here, liver disease, and alcoholism, but all of them typically do that. But the most unique is liver disease, and then B6 is also going to be alcoholism and that liver cirrhosis. Along with, again, think about B1 and B6, think metabolism, but B1 is energy metabolism, and then B6 is metabolism of amino acids, which we'll get into shortly. And from there, from there, the number one thing about B1 is that it helps a lot with that nerve function, which again, what's going to happen when we have a lot of deficiency? It's that berry where foods are mainly rice. Now we're going to have those issues with our nerves, the pain at the nerves, loss of feeling and reflexes, and change in feeling like pins and needles. Big thing about beriberi and a lot of these thiamine deficiencies is that if you don't address it soon, you run the risk of permanent damage, which again reiterates how important it is about nerve function. Nerve function is the most important thing, because if you don't fix it, you'll have permanent damage. Now, as for side effects, thankfully, it's rare by mouth meds. But an IV, it's very possible that you have the GI bleeding, angioedema, which is another way of having edema is pulmonary edema, cyanosis and cardiovascular collapse. So cyanosis and cardiovascular collapse, they're both kind of under the same line because, if you go into cardiac arrest, eventually you're going to become cyanotic. Or prior to that even too, you'll have cyanosis because you're not breathing anymore, and then you go into cardiac arrest. So those are just kind of making the connections. But one of the things that I try to make a mental note of is just trying to make those connections of what makes it unique. The big thing is that B1, in terms of side effects of that one, has somewhat similar issues like B12. So I kind of think like it's like a sandwich, right? We're not really going to put in vitamin C because that's its own different thing. But with B1, right, this is the top bun. This B1 is the top bun. And its side effects will be pretty drastic in a IV sense. The same way how down here we'll also have B12, which is our bottom bun. And look, it has regular side effects already as it is, and it also has really crazy side effects in high dosages. So, I mean, it's not the best way to make the connection, but at least you could kind of know what's going on with these big, like, major side effects, like hypokalemia, nasopharyngitis, thrombosis, and pulmonary edema, and that heart failure. You want to be careful with those because those are major, those are big. So careful out with those. As for the other ones, B2, pretty chill. We'll get into B3 in a little bit, and then B6 you do have to watch out. But we have our own little way of remembering those. So now that's finished with B1. B2, right? Riboflavin. It's actually kind of one of the most laxed of all of the B vitamins, and I would imagine it's kind of covered by a lot of these other vitamins as well. I mean, typically when you give a multivitamin, they all come, together. But I mean, we already talked about it. B2, B3, we think oxidation, and it's a coenzyme for oxidation reduction. We already know that it treats alcoholism because it's a B vitamin, and it's not B12 because B12 doesn't really do that. And I mean, its side effects are rare in high dosages. Indications, alcoholism. I mean, that's kind of it. As for, signs and symptoms of the deficiency, you have corneal vasculation, which is kind of, it's its own, that's very unique to this. So that it kind of makes it a little easier to remember, at least. Anemia is going to happen, which, I mean, kind of goes hand in hand. Again, what did we say already about B vitamins? They already kind of have a thing to do with like red blood cell production and function. So if your red blood cells are not working because you have a deficiency in B2, it's very likely that you could run into anemia the same way how you could run in like all these other ones too. And we'll see that later too, because look, megaloblastic anemia, pernicious anemia. So anemia is a reoccurring issue when there is a deficiency in general for B2. Let me pause.
Well, it doesn't really pause.
Oh.
This way.
Oh, okay, never mind.
Just keep going if you want.
Okay. So in terms of B2, right? Other than that, we have dermatitis, and then chalosis. I mean, chalosis is kind of somewhat of a reoccurring one too. I mean, look, B6 also has chalosis, and all chalosis is like it's like drawing at the corners of the mouth, right? Big thing to note is foods. We're going to start noticing that foods have a very, very common pattern with these B vitamins. Typically, they're all going to be relating to some kind of wheat. Let's see, there's wheat. I didn't even put B6 because it didn't have a lot of information on that one from the book, but we can kind of, generalize and see how it's universal because look, there's wheat, there's wheat, there's whole grains, which is another type of wheat. There's wheat again. Another thing too, look, beans, peanuts. Here we are, nuts right here. Beans, nuts, and then beans again. So notice that those are kind of reoccurring things. Leafy green vegetables are more related to B2, but it's also in another sense it's related to B9. So start noticing, like 2 and 9 will also have leafy green vegetables, right? So that's kind of one thing that makes them unique. But they all generally would come from whole grains or what do you call it, wheat, and then some of them will have the nuts and then the beans as well. So that's at least good. If again, it's a lot to memorize, but if you're able to just understand that a lot of these different foods cover these B vitamins, you'll be able to kind of cut things down and understand it. B3, right? B3. One very nice thing that I really like that Jonathan made is that he was talking about how niacin, which is B3, it's a very common component of pre-workout if you work out. If you recognize that. And what does pre-workout really do, right? So it causes you to kind of get flushy, which is a side effect right here, as seen as right here. It's our side effects, the adverse effects, right? And then it also can, you kind of say it makes you get a rash a little bit, a little bit of a rash. It could cause diarrhea, which, I mean, typically kind of a lot of different meds cause diarrhea. But, remember the flushing and the rash. That'll be a big one. And then the hepatotoxicity. So we're going to make a couple connections right now, right? Big thing, right? We already said 2,3 oxidation, right? So we're trying to get rid of free radicals, right? We're trying to it's kind of like an antioxidant, right? So we already made a note, flushing and rash. We're going to go ahead and picture somebody that goes to the gym and they are more than likely kind of on steroids, and we're going to use that for our signs and symptoms of deficiency. So again, they're going to take niacin B3 in their pre-workout, and their blood vessels are going to get big and dilate, and that's going to make them look flushy because now they're going to look all red because their vessels dilated and now there's way more blood. They're getting hot. Another thing too, I mean, if they're all red, you could kind of start thinking about like a generalized rash all over the body. And then if they're on steroids and doing all these other different things, chances are they're not exactly doing so well in their liver. So we'll make that connection too to that person on steroids. Now, as for the deficiency, it's typically your alcoholism, right? And then again, we're going to use that example about the steroids, right? So we're going to say early symptoms are FAD, the FAD diet, right? We're going to say the fatigue, which is part of the F. But the FAD diet, right, is that anorexia. Typically, they won't really want to eat other than foods that they want to make them bulk or whatever. And then a lot of use of steroids, as we saw before, causes like a lot of dry skin, like a lot of skin issues, right? So the FAD diet of the guy using steroids, he will look all flushed. He will get a rash. He'll maybe have diarrhea. The drugs he's taking is causing hepatotoxicity. And then the signs and symptoms of that deficiency is the fad diet, the fatigue, the anorexia, the dry skin because of that steroid use. Now, as for advanced symptoms, same thing. I mean, diarrhea, kind of a blanket, universal one, but dermatitis, right? Dermatitis. That's just another way of. That's just worse dry skin. So it's just dry skin but made worse. And then dementia. I mean, that one's a little bit more. It's kind of unique. I mean, dementia isn't really mentioned anywhere else here. So we can look at dementia as because of oxidation, right? So it's being used to destroy free radicals. Maybe it could mess with the neurons and cause too much damage and eventually cause dementia. I don't know. Best kind of way to make the connection. And then, as mentioned before, look at our foods. Look, wheat, whole grains, beans. Look, beans right there. Beans again. Whole meats, which you'll find mostly in your B12. But look, yeah, it's all patterns are starting to show. Now that we're finished with B3, we could go ahead and go to B6. So what did we say about B1 and B6, right? So we said that B1 and B6 have a lot to do with metabolism, but B6 will be about metabolism of amino acids. So again, it seems like when we have an issue with our body, right? We have failure, we have alcoholism, we have this one's a little bit of a weird connection to make, but uremia, right? We have chronic kidney disease. We have heart failure. We have all these different things going on. I mean, alcoholism will mess with your liver. So like issues with your liver, like I said, look, cirrhosis and alcoholism. So we typically have dying tissue because of liver cirrhosis. We have dying tissue because of chronic kidney disease and heart failure. So the biggest things to remember is that we want to get rid of all that tissue. So we want to, and what is tissue? Like it's proteins. And what are amino acids? Amino acids are just proteins put together. So big thing to watch out for is that again, we're metabolizing amino acids, which will apply to this situation because we want to get rid of all that in order to like what happens when a big fire happens in the mountains, right? It's like it resets the mountain and you're going to grow new trees, which is what's going on here. You want to get rid of the bad tissue, get rid of that, flatten it out, and then you're going to regrow the cells. Ideally, I mean, again, these things are not a miracle thing. They're not a miracle product, but they could help. Same thing, chlosis and irritability and fatigue is going to be the signs and symptoms of the deficiency, which, I mean, look, fatigue, that's reoccurring. Chlosis, that's reoccurring for B2. So a lot of these signs and symptoms of the deficiency are they're kind of connected. And then for foods, we'll just chop that up as the same sources as we've been getting for all our B vitamins, our whole grains, our beans, our peanuts, our we'll just go with those just to be on the safe side. Nuts, wheats, whole grains, and peanuts. Or maybe we could also say cheeses, perhaps eggs, but we'll at least go with the safe ones. Those the wheat, the grains, and the nuts, the peanuts. All right. Now, as for
Before we move on, B6, when combined with antihistamine, reduces morning sickness. And in the MyLab, there's a question: what someone who has cancer and is nauseous, what do you give them? And the answer is B6.
okay, yeah. So that gives a perfect example, right? Morning sickness, things are going on, issues are happening. A person with cancer. I mean, again, cancer. There's a lot of damage going on right now for throughout their whole body. That damage, we don't want that just floating freely in the body. So you would give that B6. So again, cancer, uremia, which is just a lot of like byproducts of protein destruction. But again, you want to get rid of those two. chronic kidney disease, your heart failures, all these different issues where the body is having too much damage, B6 can metabolize those amino acids and help us remove it from the body so you can grow those new trees like we made with the example of the mountain example. Now, as for the side effects, I would imagine that because B6, right, it's a metabolizer of amino acids, maybe like how we've already talked about it so many times with all our different other meds, is that if you overuse them, you'll cause damage to the things you were trying to fix in the first place, right? So if you damage, these metabolism of amino acids, you might over metabolize your nerves, or you can cause damage to, if you cause damage to your nerves, will you want to move that much because you're in pain? Probably not. And then a lot of big damage to your nerves can cause seizures as well. So there you go with that. I mean, it's like CNS like damage. So you do have to watch out because again, it's a metabolizer of amino acids. So it does something good, but it could also work a little too good. Now, finally finishing up with vitamin B9 and B12, right? So one way I like to look at B9 and B12, I like to think of it as B12 is our primary meal, right? It's the main course, which is we see it in all the different foods that we have right here, right? We have it in the meats, seafood, dairy, eggs, like fortified foods and all that. So, but the biggest one is meats and seafood, right? That's the main course of the food, of the meal. And B9 is like our back, like our I guess like the something to make it, so you're not just straight up eating meat, like you're supplementing it with something, something to kind of help out with your palate. And usually, like I would imagine, I think of like, B12, I think of a steak, right? So when you eat a steak, what typically happens, especially if you go to like a Western steakhouse, they're going to give you beans, which is B9, and then they're going to give you your bread, which is your wheat, and then typically you could also get veggies like, I don't know, asparagus or something in that steakhouse. So, B12, think of your meats and seafood, your main course, and then B9 is that supplement of those green veggies, your asparagus or whatever, your spinach, your salads, and then you have your side of beans and your bread that they always give you to fill you up in order for you to not to, I don't know, buy more food or something, or so they could save money or whatever the heck. But as for B9, right? B9 is typically, and this is super important because this is the biggest thing, it prevents neural tube defects. And that's for pregnancy. People who are pregnant, because again, it makes DNA and RNA. We need that in order to make a good, nervous system, a normal nervous system. So the indications are clearly going to be for pregnancy, and the reason why is because of the DNA and RNA synthesis. There's that hematopoiesis again. I mean, again, it's a reoccurring thing with B vitamins. But the most important things to know is that pregnancy and that DNA and RNA synthesis. Because if you don't have it, then you're going to have neurotube defects. And then if you don't have it as well, you could have megaloblastic anemia, which is it's a type of anemia where your blood cells are kind of like, they're like kind of overgrown. They're way too big. And if they're way too big, that also messes with the structure of hemoglobin. And if we've seen it in physiology, if you mess with the structure, then that's going to cause iron to not work because, again, it won't recognize the structure, so you'll end up with a type of anemia. As for the alcohol, again, the indications or deficiency, we have alcoholism, overcooked food. But I mean, if you think about it, overcooked food kind of affects all these other ones too. Increased demand, which is our pregnancy, which we already covered right now, and then B12 deficiency. I mean, that there it goes again. B9 and B12 are both interlocked. And the big thing too is that a deficiency in B9 will mask a B12 deficiency. And then a B12 deficiency will also cause a B9 deficiency. So again, that's why I like so much of that B12 is your steak and B9 is your side dish or whatever, because they're both interlocked. They're both hand in hand.
They're both related to
Yeah,
pregnancy too.
Yeah, they're both related in the same sense of pregnancy because they're very, very important. You know. Now we'll move on to B12. So B12, component of two coenzymes which are important for growth and division, right? So it's the big one regarding that. And I mean, when we hear B12, one of the biggest indicators already is a vegan diet. Because again, look, it's found in meat, seafood, dairy products, anything that comes from an animal, really. So if you're vegan, you're going to need B12. The same way how you would also give zinc for B12. Because look, if I recall right, or magnesium, one or the other. Hold on. Give me a second. There it is. Inadequate or vegetarian diet. So when you have a vegetarian diet, you would give zinc and you would give B12 right there. So we already mentioned it. Here's all your foods. Um, the thing though is that this one will cause side effects even with regular dosages. It will cause that headache, cause a rash, it'll cause arthralgia, it's a little hard to say, arthalgia, which is basically pain upon movement at the joints. So joint pain, basically, and diarrhea. So you kind of just have to remember these a little bit. The headache and the rash, those are kind of sort of seen everywhere, and the diarrhea as well. But that joint pain, that one's a big one. And then for those high dosages, what do we talk about in terms of B1 and B12? Look at these crazy like side effects with B1, and here's that crazy side effect with B12 at high dosages. So remember of the sandwich, that top bun that has a lot of crazy side effects if given at high dosages, and B12, that bottom bun that also has a lot of crazy side effects in high dosages. One of the biggest causes for B12 deficiency is no intrinsic factor. You need intrinsic factor in order to absorb B12. So if you don't have that, you know, you're going to lose out on that important B12. It's like basically saying you don't have vitamin D, so you can't take in you can't take in calcium. You need vitamin D in order to take calcium. So in order to get, vitamin B12, you need intrinsic factor. Another thing too, inflammatory disease of GI tract. I mean, this one is a malabsorption issue. This covers pretty much everything that we've just talked about because it's a malabsorption issue. And there it is again, vegan diet. As for the signs and symptoms for this, especially for no intrinsic factor, it's that pernicious anemia, and a lot of it has to do with memory or like mental status, like memory loss, confusion, unsteadiness, mood disturbance. So kind of remember those. It's the same way how B1 again has that record of being about nerve function. And, this one's more about like, control of the nerves. B1 could also be about, mental status as much as also control. And then the biggest thing too is, again, those that are biggest at risk is your vegans, your vegetarians, and breastfeeding mothers who also don't take animal products. So that could be made an argument into a veganism. So that was pretty much all our vitamins. Again, I hope we made good connections, so it could at least help you out in retaining this information.
Oral contraceptives block B6.
Oh, big thing about oral contraceptives, they mess with B6.
Yeah.
Big thing about this one. If I recall right, though, a lot of oral contraceptives kind of mess with a lot of vitamin absorption in general. Like even with, it's not just B6, but a lot of them mess with a lot of these water soluble vitamins, if I recall right. So that is one thing to watch out for. All right, I'm gonna stop. Yeah. Okay, so now we're gonna get into our minerals. So the nice thing about minerals, these are our micro minerals. I'm sorry, macro minerals. Sorry, can't read. Um, the nice thing about learning about magnesium, potassium, calcium is that this all is review. All of it is basically review that we did in our electrolyte chapter. So the nice thing is that we just have all this information right here at your leisure. and you can check it out whenever you want because again, it's all review. It's all the info that we had all the way up here. All these slides all the way up here. They're all found right here at this information. So at this grid. So use it as much as you want. We're just going to go ahead and jump that because this video is going to be long as it is. So we'll just jump more into or we'll kind of pick and choose a little couple things that maybe we didn't cover on those on the slides. So at least when it comes to calcium, right? Calcium plays a role in clotting. That's kind of the big one, at least. That's different. And also, we should watch out with our blood serum because apparently calcium can cause decreased levels of phosphate and potassium. So we just got to watch out with those just in terms of that. But other than that, that's really it. Just do remember with that potassium chloride as well. You don't give IV push. You only give peripheral IV. Peripheral, watch out with that. It's peripheral IV, and it's those 10 mil equivalents per hour as well. Magnesium, we already went through it a lot. We covered it already prior to this, but just watch out with this because again, big covers for it. So we'll just jump right into iron and zinc because these are kind of the newer ones, right? At least iron too. We didn't really have a slide for iron. So iron, we talked about it already a little bit with vitamin C, right? So iron, if we don't have adequate levels of iron, that typically messes with our hemoglobin because hemoglobin is it contains iron that gives us the capacity to get oxygen to the red blood cells so the oxygen can then be transferred to every tissue in the body. These three indications are basically all just one giant way of explaining that, hey, without iron, you can't have good hemoglobin, and then it can't produce good blood cells, and then, it reverses iron deficiency anemia because, again, iron deficiency anemia, what do you give? You give iron. You give that ferrous sulfate. There's also ferrous glycinate, but we have ferrous sulfate. And then iron, it's just reiterated. Iron is essential for oxygen transport in blood and for cellular energy production as well. And in fact, it's actually one of the most common deficiencies ever. You hear that very often, actually, a lot. Big thing, just to review a little bit, remember, you take it with vitamin C to enhance that absorption because it helps out a lot with it. Now, as for signs for side effects, right? Typically, I've heard of it before. People have gone nauseous. People have had constipation or diarrhea, which makes it kind of interesting because either or can happen. But I've heard a lot about constipation. I remember hearing that. Abdominal pain, cramping as well. So we could kind of look at iron a little bit as slightly kind of sort of acidic. And this will come up in a little bit. As for IV forms, you want to watch out for this one because IV forms are very, very dangerous by the look of it. Anaphylaxis is your hypersensitivity. That's universal, but it can cause shock. Hematoemesis, which means vomiting blood. Hepatotoxicity, it can mess with your liver. It's a strong, it's an iron. It's supposed to be a micro mineral, but it's still much more potent, especially if given an IV form, because it's just directly right there. Hypotension is another way of saying hypovolemia. And then metabolic acidosis, again, there it is. It can cause a little bit of that. We see iron as a little bit acidic in the body. You're going to go ahead and monitor your calcium levels because iron actually decreases a little bit of the absorption of calcium. Then we also have our bilirubin, which is our BUN. Oh wait, no, I'm sorry. That's blood urea nitrogen. So yeah, bilirubin, you just keep an eye out for that. Good connection would probably be like my friend Billy. He's low on iron, so I gotta watch out for him because he might pass out because of the anemia. I don't know. My friend Billy, low on iron. Kind of think about that. And then I have to watch out more for Billy, so you have to watch out for Billy Rubin more because he has issues with his iron. But don't look further into that more. It's just think of Billy Rubin, my friend Billy. I have to watch out for him more because I know he has anemia. So be careful with him.
That plays into the hepatotoxicity, right? Where does Billy Rubin come from?
If I'm trying to recall right, isn't that the gallbladder? Oh wait, no.
Should be your liver.
Yeah, the gallbladder is part of the liver, no?
I mean, they probably do digestive enzymes, but I would think.
Yeah, because Billy Rubin bile, right? Oh wait, I forgot too. Billy Rubin as well. That's what makes your stools look brown. Billy Rubin is what makes your stools look brown. All right. Well, anyways, moving on. So, prevention and treatment of again, these are our indications, right? Iron deficiency anemia. It was already stated over here. Rapid reversal. Again, it's already stated over here. And replenishment of iron storage. There it is. It was already said. So again, iron is very big on iron deficiency anemia. And then the signs and symptoms of deficiency are typically your shortness of breath because, again, our iron is messed up. Our hemoglobin is messed up. So that means that our hemoglobin, which is what carries oxygen in a red blood cell, can't carry oxygen. What will that happen if your hemoglobin is bad? You're going to start having shortness of breath because you can't breathe that well. Because your capability from your iron in the hemoglobin is down. Fatigue and weakness. I mean, that's what happens. You're going to be fatigued. You're going to be tired. You're not really going to want to move around because your oxygen storage is pretty bad. And then what happens when you don't get enough oxygen? You get a headache. Biggest areas to find them is your whole grain breads, your fortified cereal, your red meats, your fish. So think meats and think fortified cereals, grains, and breads and all those types of things, which is kind of like not too difficult to kind of think about. And then as for teaching, it takes a while for this stuff to work because I mean, after all, if you're low on iron, I mean, all your blood cells are affected, and you're not going to quickly make them like out of nowhere. I mean, typically you could, you have your blood developing all the time, but I mean, it's going to take a bit of a delay. So you should tell your patients, hey, watch out. It takes a little bit of time. As for, here it is again. So avoid dairy products and acids because they inhibit absorption. Because what did we say? Iron is slightly acidic. It causes that metabolic acidosis. So if someone is iron deficient, the last thing we'd want them to do is take dairy and acids because that's going to mess with their absorption. Another thing we should be watching out with is take it with food because it could cause a GI upset. What did we say happens with a lot of these different foods that can cause like problems with that are kind of acidic? They're going to cause that GI issues. So you take it with food, you take it just to lower the possibilities. And then another thing too is that it comes up later, but peptic ulcers, any types of ulcers or ulcerations, you need to watch out with that because, again, what is a peptic ulcer caused by? Mainly it's caused by too much acid in the GI tract. So if you give more iron, that can cause a peptic ulcer to get worse. Or ulcerative colitis as well, And then black box warning, right? We did say that iron deficiency is the most common deficiency ever. Typically, kids, they're low on it. But what happens? Sometimes those kids, they eat a lot of those, multivitamin gummies or, vitamin and mineral gummies or whatever. And if they take too much of that, that could be detrimental. And an accidental overdose can cause a lot of issues, which is what we talked about, in these IV forms, like where it's really, really bad because, again, look at that. Hypotension, hypovolemia, hepatotoxicity. That's where it all comes in. Right? And as Jonathan was saying, hepatotoxicity is a direct line into this bilirubin. So watch out with that. You don't want to nuke your liver while you're fixing your iron deficiency anemia. As for zinc, right? We already talked about it in the earlier slides, but just to review a little bit, right? So it's essential for metabolism. It's helpful for wound healing. It's helpful for aromatase. It's helpful for insulin production and glucose, and that very unique mineralization of bone. So it works with PTH again. PZ. Think of PZ like, oh, it was easy. It was PZ to remove that mineral from the bone because of our zinc and parathyroid hormone. I don't know. It's a little silly, but it works. High dosages. I mean, these could they're a little bit, nausea, vomiting, fever. Maybe you could think of zinc as kind of like the flu. Zinc, flu, the flu. This kind of gives you that. The flu usually gives you a fever, makes you nauseous, makes you vomit. And then look at that, immunosuppression. So, I mean, after all, the flu is trying to suppress your immune system so it gets the better of you. So there you go. You could kind of use that again. And then, it could cause anemia. So that's a big one too. I mean, right here it says, for a little thing that I forgot to mention, calcium. Avoid zinc-rich foods because they impair calcium absorption, which again, what do we say? It works with clotting. Calcium works with clotting, so if you mess with that, you're gonna mess with an anemia factor right there. So I mean, typically you watch out for your hemoglobin because of that anemia that we said. We just talked about it, clotting, absorption of calcium. So you want to watch out with your hemoglobin. Especially with that immunosuppression and anemia. You want to watch out with your CBC because, again, if you're causing anemia, you just need to watch out with that. Liver, you always watch out liver. And immune function, I mean, there it is, immune suppression. Deficiency, again, we talked about it already. Major surgery, trauma, vegetarian diets or inadequate diets. And then the symptoms is poor wound healing, reduced taste perception, poor glucose tolerance. Again, if it helps with glucose regulation, then if you have poor tolerance, then that's probably a sign of the deficiency. There's a dermatitis. There's hair loss as well, sterility. So again, we can make that connection about like what was the connection again? It was like over the state, like male sterility.
Or it said male. The book says male fertility.
And
she has sterility.
Sterility. Okay, yeah. So just make a big note in terms of zinc. It has a lot to do with lowering. I mean, it's not that it does, but watch out because it has an effect on male. We'll just say male just to make it easier to remember. But we'll watch out because if you lower those testosterone levels, it can cause sterility. It could cause dermatitis, and it could cause hair loss because without testosterone, you can't grow hair. As for your foods, I mean, look at that. Lean meats, organ meats, oysters, poultry, fish, lots of meats. A lot of meats. That's the reason why an inadequate or vegetarian diet will cause issues with zinc, which is why you give zinc with vitamin B12 because they're mainly found in meats and animal products, the same way how these are all animal products. And then vegan patients would benefit from zinc, and they would also benefit from vitamin B12. In terms of here, this was not completed, but at least oral contraceptives, a lot of them have issues with a lot of these vitamins, actually, and minerals. And then oral contraceptives could also show an increase of copper. I do recall hearing about that. I mean, what is it like? IUDs is also like IUD is a type of contraceptive, right? And aren't some of them made by copper, right?
Yes.
Yeah.
Right. Yeah.
So you could kind of think about that. A contraceptive, I mean, in this case oral, but a contraceptive, they have high levels of copper, like those IUDs. So there we go. So that's pretty much a review. I mean, it wasn't the cleanest review, and I apologize because it would have been a little bit cleaner if we had the presentation. But we're doing what we can. We're sorry about that. But I'm really hoping that at least the connections we made with these past grids, and I hope these grids help everybody out with at least having all this information. The main whole point of why we made these grids is just to give everybody all the information, and then from there you can kind of form your own patterns. You can pick and choose what you want to emphasize more on. But I really hope this helps out. I mean, after all, we're all trying. Okay, so now we're kind of coming to the end right here. So we have the role of the nurse, right? So monitor for mineral deficiencies or eclampsia. So mineral deficiencies is a little bit more for every single mineral that we talked about, micro or macro. But as for eclampsia, what did we talk about? Magnesium is used to lower seizures. Look all the way up here. We're going to go ahead and talk about it again. They lower the possibility of seizures or treat seizures during eclampsia. Magnesium. There it is, magnesium. So do keep that in mind for being the role of the nurse. Large doses can cause life-threatening adverse effects. Guess what? We also learned that in our vitamins. High dosages and our electrolytes. High dosages or low dosages of the vitamins, minerals, electrolytes can all cause life-threatening adverse effects. Encourage a well-balanced diet, which is something that you're supposed to do in general. Well, if giving calcium, right? This is where it's a little bit more like kind of just going to have to learn it, right? Glucocorticoids, we did learn that heavy use. I mean, after all, just a little review for our testing from our past 2 exams, right? They had a lot to do with corticosteroid use. What is something that we learned? They cause osteoporosis. So if you're going to take glucocorticoids, you should probably increase your level of calcium because you don't want to cause any osteoporosis. So minimize that tendency of osteoporosis. Thiazide diuretics. We talked about that thiazide diuretics lower your levels of sodium. Well, thiazide diuretics can cause high levels of calcium. Tetracyclines could actually mess with the absorption of calcium. And we're actually going to go into that when we talk about antibiotics. But watch out with those. Zinc-rich foods, they impair calcium absorption. We just talked about this. They were right here. They were right here. Avoid zinc-rich foods because they mess with calcium absorption. As for phosphorus, right? So phosphorus is kind of a base. It's a little bit basic. It can be used as a buffer. So obviously, watch out using antacids because you're just running the risk of making somebody alkaline at that point. Another thing too, high levels of phosphorus can cause seizures. And what did we talk about in our electrolytes and fluids, our electrolyte and fluid presentation? We talked about how metabolic alkalosis will cause CNS stimulation. And what did we say that is the epitome of stimulation? Seizure activity. So if phosphorus is alkaline, causing this seizure activity will be a product of high dosages of phosphorus. So watch out with that. Little callback to that presentation. And then one big thing too, if the patient is on sodium and potassium restriction, they have to find an alteration for phosphorus because the 2 supplements really is sodium phosphate and potassium phosphate. And then obviously if they're taking sodium or if they're having a sodium or potassium restricted diet, they can't take these. So watch out with those. And then reiteration, magnesium sulfate. Changes in those CNS, that CNS depression because magnesium is a relaxer. And then watch out for that thirst and confusion because these are going to be your early symptoms. These are going to be your late symptoms. So what did we, making that little connection to high levels of sodium, they're going to cause thirst. They're going to cause confusion. They're going to cause, that dehydration and all that stuff. And then once it's late, it causes those, these really bad signs and symptoms. So there it is. As for undernutrition, we talked about this. I made a big emphasis. These are all recognizable that they're going to cause issues with having good nutrition. Low dietary intake, that's so cut and dry. Malabsorption, that's just low dietary intake with extra steps because your body isn't working. Fad diets, people that are not eating appropriately because they want to lose weight or they heard this and that can change things out. Like that can cause malabsorption or undernutrition. I'm sorry. Wasting disorders, especially wasting disorders or AIDS. Again, if your body's wasting away, you need to increase. What did we talk about? Usual indications for adequate nutrition are increased need, illness, things that require more intake. And if you're having something like this, like a wasting disorder, you need that extra intake. Chronic inflammatory bowel disease, which is going to cause malabsorption disorders. Eating disorders goes back into dietary disorders. GI disorders, again, malabsorption disorders. Chronic neurologic disease, if your nerves aren't really working. And, what did we learn? Usually when you have issues with your nerves, you also have issues with your GI tract, because all of that is interconnected. Surgeries, you're going to need more proteins, more foods, more intake, because you need to recover from that surgery. Trauma, I mean, that you would get surgery for trauma, because again, trauma, you're healing, you need more food. And then poverty, that one's as cut and dry, which unfortunately just being low dietary intake because of inadequate food. So when you're in poverty, you end up having to resort to having to buy, I don't know, a cup of noodles, and because that's the only thing that could really, you could buy in bulk for $5. And is that the most, I mean, it's good, but is that healthy? Probably not. And that could eventually cause you to become undernutriated, because again, it's not very strong with nutrients. And the most important thing to do is drink water. What did we talk about in our electrolytes and fluid grids? You would typically advise your patients with high levels of anything to drink water if it's mild. If it's mild. If it's really bad, then at that point you need to do crazy stuff. But if it's mild, tell them to drink some water, get moving a little bit, so the body can work as it's supposed to, so normal physiology can occur. And then we finally come to our last slide, our enteral and total. There we go. Total parenteral nutrition, right? So enteral nutrition can be given orally, or it could be given through a feeding tube. It could be given through a G tube or a J tube or a nasogastric tube. Any of those types of tubes. The whole point is that you're meeting the patient's nutritional needs while also having them use their GI system to metabolize whatever they're taking in. Their GI tract is still working. You obviously, in both situations, you're going to watch out for fluid overload. What is one thing we learned in our skills? We check residuals. What is something that we also learned? INOs, because we don't want the patient retaining those fluids, because what's happening? One, they're getting malnutrition. And then two, now they're running the risk of edema, which edema can then eventually cause pulmonary edema, then it could cause other different issues, and then heart failure, and then CHF, and so on and so forth. So we want to watch out with those. And then now as for total parenteral nutrition, right? Hyperalimentation. So that we can look at as like food going straight into the blood. Obviously, it's not food that we traditionally know about, but it's food. And all that food, I mean, it's going to be high in sugar because it's needed. And one of the big things is hyperglycemia occurs because it's going straight into the blood. Professor Huang said that phlebitis is very occurrent and infections are very occurrent, because what is bacteria like? They like sugar, which it has a lot of glucose. Phlebitis, I mean, it irritates the body. Having such a high concentration of glucose getting into a blood vessel, that's going to irritate it. Like any type of fluid, it will irritate your body. And then it's administered in a fusion pump because we want to be 100% sure. I mean, it could be given in a central line. It could be given in a peripheral line. One thing we learned about central line feedings is that you need an infusion pump, because you need to know exactly how much is going into that patient, because if you don't, you run the risk of causing some really bad stuff. And then this is just giving them nutrition just ready to use for the body. It's not going to be proteins, it's going to be amino acids, because amino acids are completely broken down. It's not going to be straight up like sugars all the way. It's not going to be polysaccharides or disaccharides. They're going to be our monosaccharides, our glucose. They're not going to be our maltose, our lactose, and our fructose. They're going to be just straight glucose. And that's essentially it for this. And this, I added the vitamins slides provided by the vitamins group. A lot of good information here. In fact, I used a lot of this information for the grids we made, presented earlier right here. So I want to thank them all for all their information that they provided. I see this whole thing as a group effort, so I really hope all this stuff helps. Sorry for being a little choppy, but hopefully this all helps us out with studying a bit.
Sterile procedure. Right?
Oh, yes. I mean, this would all be a sterile procedure, basically.
Sterile procedure.
Yes.
Bolus feeding. Water bolus before you give.
Oh,
Right?
like yeah.
You have to bolus, yeah.
I mean, it's like you flush.
Yeah.
Yeah, like you flush before you give.
2 pounds in 24 hours, right?
Oh yeah, yes. Watch out with 2 pounds because again, if they're retaining it, that's our INOs. They're retaining fluid. That's it.
And just like the what's it called? X-ray, right? Just like the.
Oh, check placement. Yes, of course. Yeah, check placement.
That's it.
All right, yeah, that's pretty much it. So again, I really hope that this stuff helped. We're doing what we can, so I really hope that everyone can benefit from this. All right, but everyone take care.